Alright, I've got the tissue pretty well warmed at this point. So now I can use petrissage, which will be my deeper, more specific technique. So I'm going to come in with a loose fist, and I'm going to perform circular kneading, or kneading. And this technique is really more specific into a certain part of a muscle, as opposed to effleurage, which is getting a group of muscles. This becomes more specific and a lot deeper. As I perform this technique, the circles that I am producing are very small. It's not effleurage, so I don't want to do big circles like this. They're going to be very specific circles. It again is a technique that comes from the movement of your legs and your torso. You'll notice that my shoulder is not moving and my wrist is not moving. It's all coming from leg power. I'll slide my tool up to another spot on the muscle tissue and go in deeper here. I'll do about 4, 5, maybe 6 very specific circles in this one spot, and then I'll slide my hand up and perform it a little bit higher on the muscle. So you want to cover the entire hamstring with this tool. When I need to work on the lateral side of the thigh, I'll change to my hand that's on the lateral or outside, and I'll perform the technique again. And as you'll notice, it's all kind of just movement from my lower body as I come up and kind of power down into the circle, power down into the circle. I'll slide my hand up, repeat the process again. Again, this technique is a lot deeper than effleurage. We're really trying to loosen up the fascia even more. We're loosening up muscle adhesions. We are trying to decrease hypertonicity in the muscle, or muscles that are too tight. Another technique that is good here is a petrissage technique called ringing. So I will step in front of the body that I'm working on. My hands will start opposite of each other, one on the inside, one on the outside. I will perform a compression first and then let my hands slide past each other. It is a technique called ringing. Almost envision wringing out a wet towel. So you're going to compress and slide your hands past each other. It's important as you perform this technique to make sure that your lower body is kind of shifting side to side. It helps you propel the technique. It's also important to keep your thumbs with the rest of your fingers, almost like a paddle. Don't let your thumbs lag behind, because there will be a lot of stress on that thumb joint. So keep your thumbs with the rest of your fingers. And just wring that tissue out. Again, compress. And you don't want this technique to be fast. You don't want to do something in this fashion. You want it to really engage the tissue as you wring it out. So I've done all of my work to the proximal extremity, to the thigh. So I'm going to smooth this out. So I'll step back into my lunge, facing the client's head, and just smooth my work out. So I'm going to go back to an open palm and push up once, push up twice, just to smooth everything out. And then I'll come and start working on the calf. It's been a moment since we've put lotion on, so you may need to put just a little bit of lotion. So now I'm going to work from ankle to the back of the knee. So as I did on the upper part of the extremity, I've got to warm the tissue up first. So I'll use open palm effleurage. Again, you'll notice that my body is moving. I'm just leaning my weight kind of forward, pushing off from the back leg and up, and back to my back leg. Change to a loose fist. Open your hands right at the back of the knee and come back. One thing you want to be careful of is not putting pressure right behind the back of the knee. So as I come up with my good pressure, I'm going to lighten it just for a moment at the back of the knee, open my hands and come back. Just push up, open your hands, come back. A nice technique to use here in the lower leg is thumb pads. Thumb pads are not very strong, so I don't want to do one thumb pad. I want to reinforce and put my two thumb pads together. So I'm going to start from the ankle and push up with a thumb pad, lighten my pressure, come back. Move my thumbs to maybe the lateral side, push up, come back, move my thumbs to the medial side, and push up. You can also deepen your lunge and use a forearm if you like. What you want to be careful of when you are using forearm work anywhere on the body is that you are still, even though in a deep lunge, you're still moving your lower body. You don't want to push with your shoulder like this, because it will be all power from your shoulder, as opposed to it's all coming from my legs. The client will be able to tell the difference as well in the pressure. So I've got the lower leg well warmed up at this point, so I can come in again with my more specific petrissage technique, kneading or circular kneading. To get more specific, get a little bit deeper into the tissue, and I'll just focus my work right here. Trying to loosen up again any tightness or too much tone in the muscle. I can also do ringing here as well, like I did in the thigh. Move your lower body. Squeeze first and then ring. Squeeze first and then ring, keeping your thumbs with that. Another technique here that's very useful is squeeze kneading. So I'm going to squeeze the tissue between my thumb and fingers, and I'm going to simply pass it back and forth between hands. Again, lower body movement is important just to help propel the technique. Nice and slow, nothing fast. You can take this technique down right onto the Achilles tendon, right at the ankle. Trying to really focus on all of this area, not just one in particular. All right, I've done my deep, kind of more specific work into the lower extremity. So, as I did with the thigh, I'm going to just smooth my work out. So go back to my open palms, smooth out once, smooth out twice, and then last, if we keep with the principle of proximal and then distal, proximal, I have to push all of the fluid out of the leg centripetally or back to the heart. So I'm going to use the webbing between my thumb and index finger, put one hand on the right above the ankle, one hand right in front of it. You want to keep your back straight, your arms straight, your head up, and you're going to apply some nice pressure. Push the fluid up. When you get to the back of the knee, you're going to lighten your pressure, skim over the back of the knee, step up with your back foot, step up with your front foot, resume your pressure with straight arms, and continue all the way up the thigh and off to the side. To redrape the leg, you're going to simply untuck, cover up the glutes first, lift the leg up, facing their head, pull the sheet down from the outside portion of the table back into the center, put the leg all the way down, and then bring the sheet over to redrape the posterior leg.